Good afternoon and welcome to Capture the Caller, Turning Inquiries into Admissions in Private Duty Home Care, a live web conference from the Academy for Private Duty Home Care. I'm Jill Scott, the Manager of Member Services at the Academy for Private Duty Home Care, and I'll be your moderator for today's web conference. Before we get started, I want to give you a few details about how our web conference will work. Earlier today, you should have received a copy of the slides for today's presentation in your email. If you did not receive a copy of the slides and would like to receive a copy, you can send me an email at jill@leadinghomecare.com and I will send you a PDF of the slides. We will pause several times during today's conference to answer your questions. Since we have such a large group today, all phone lines will be muted. If you want to ask a question, here's how it works. When you want to ask a question, go to your participant control panel on the screen. Find the questions box in the lower section of the control panel. Type in your question and hit send. I will read your question so that Stephen and Michael can respond. Or I'm sorry, Stephen and Barbara can respond. You can type in your questions at any time, and when we break for questions, we will take them in the order in which they were submitted. Okay, so let's get going. Research conducted by Leading Home Care shows that most home care companies are wasting sales and marketing money because they are not tracking the number of inquiries coming into their office and the percent of inquiries that are converted into admissions. In working with hundreds of home care companies on sales and marketing strategies, we've learned that most companies can grow their business by 20% by just doing a better job of answering the telephone, engaging the caller, and converting phone calls into home visits. Today, we want to share with you the latest insights into how your callers respond to the way you answer the telephone. Barbara will give you insights from what she has learned conducting hundreds of mystery shopper calls. And together, Barbara and Stephen will show you exactly how to grow your business by converting more callers into customers. Our host for today's program is Stephen Tweed. He is the CEO of Leading Home Care, a Tweed Jeffries company based in Louisville, Kentucky, and founder of the Academy for Private Duty Home Care. Our special guest today is Barbara Akst. Barbara is the President and CEO of Training Unlimited and a nationally recognized dynamic and motivational speaker. Barbara's consulting and training style, combined with her follow-up strategies, ensure success for the companies and organizations working in the seniors industry. Barbara has an extensive background in education and consulting with a special focus on the senior services industry. She has developed and presented numerous workshops nationwide. Her expertise in identifying and solving management and census issues, coupled with her training, coaching, and mentoring skills in formalized follow-up, are a perfect formula for continued success of sales staff in the senior industry. She holds a master's degree in educational administration. Barbara is also the co-author with Stephen Tweed of the popular e-book, Capture the Caller, Turning Inquiries into Admissions in Private Duty Home Care. To get us started, please welcome Stephen Tweed.
Well, thank you, Jill, and welcome everyone. It's delightful to have so many of you back for this program and some new names on the list that I don't recognize, so welcome everyone and thanks for being with us. We're really excited about this final webinar for 2012 as we wrap up a series of programs we've done over the last 6 or 7 months, and this topic of Capture the Caller is one that is quite significant. Barbara and I were talking before the program about when we wrote the book and some of the things that caused us to recognize the need. So Barbara, welcome. Thanks for being with us today.
Thanks, Stephen. I am absolutely so excited to be part of this because I have a passion for what we're talking about today, and I believe it makes such a difference in everyone's lives, and especially in their business.
Jill read a little bit of your biographical background, but tell us just a little bit, Barbara, about the kinds of organizations that you've worked with in the senior care industry, just so our listeners get a sense of the practical things that you've really done in this industry over the last couple of years.
Well, my philosophy in training and development and coaching and mentoring folks is that I have to have been there and done that. Having an educational background is not enough, but having the practical and experience in the field is, to me, what's paramount for success. It was the late 90s when I was elected to be the primary caregiver for my father-in-law, and in that process I ended up, from the adult-child perspective, of having to go through trying to find home care through hospice, through placing into a senior care community, and then floundering when I lost him when he died. And I realized I had gone through such trauma in that process that I wanted to help another adult child not have to experience that. So I decided that the best way for me to do that was to become part of the senior care industry. But I had no formal training in senior care except being an adult child. So I went to work in the industry, and I started at what I call the bottom rung, but to me is the most important job in the industry, and that's the person who answers the phone. And I started out with an assisted living community. I worked my way up through into a CCR until I became the National Director of Healthcare Sales for one of the major companies in the nation, and began training and developing and working with their team. It was after doing that for quite a while that I realized I could go back to what I love doing, which was helping others like all of you who are on this call today to make a difference in the lives of another senior. And it's by having been there and done that that I feel most qualified to be here and sharing the strategies and the ideas and my experiences to help make you more successful.
For the audience, I first met Barbara when we were speaking at the same conference a number of years ago, and I sat in the back and listened to her presentation, and I really liked her her style and the message. But what I was really taken back by was when she talked about some specific examples of what she had heard in talking to home care companies, and you sort of got this look from the audience like, oh no, our people would never do that, and then she played the audio. And it was very interesting because these were actual live recorded interviews or mystery shopper calls to companies of people that were sitting in the audience. And you could watch as the person sitting in the audience realized that it was their staff person who had made that call, and they were probably a bit embarrassed that that's what was happening in their company. And so when I saw that interaction and saw the power of that, I immediately approached Barbara, and we got acquainted and have become great friends since then. And so it's been delightful over these last couple of years to work together on the book and on some other programs. So let's jump into looking at this concept of handling inquiries that come into your home care company and converting them to admissions. And many of you perhaps have participated in the 2012 private duty benchmarking study that was conducted by Home Care Pulse and the National Private Duty Association. And this on the screen is some data from the 2010 study and the 2011 study. And we see up there that we look at, in the 2010 data here, we're realizing that we can see that all companies that participated in the survey, and there were about 550 or 75 companies, the average conversion ratio from inquiry to assessment was 36%. In 2011, that number went for all companies up to 39.3%, which is a nice increase. However, on this slide, we also see that the data showed the conversion ratio for what the researchers called the leaders, and these were companies that were $2 million or more in revenue, and in fact I think the median size for the leader group was about 3.3 million, and we can see that their average conversion ratio was 44.7% in 2010 and increased to 49.5% in 2011. However, as we look at these numbers, we realize that even at 39%, let's call it 40, that means that almost 2/3 of the calls coming in are not getting converted to an assessment or into an admission. And so those are pretty interesting numbers. So then we go to the next slide, and we look at the conversion from assessments to admissions. And again, we see 79% for all companies in 2010, 80% for all companies, and then we see the leaders up here at 91% approximately. So again, we see the differences between the total population of the survey and these leading companies. But what's more important is that when we look at this number, we see that when you're able to take that inquiry telephone call and engage the caller in a conversation and earn the opportunity to come out and conduct an in-home assessment, then you realize that the conversion ratio is going from 40% to 80% and maybe even as high as 91%. So that gives us some pretty significant numbers to look at to validate the importance of what we're talking about in this process of capturing the caller. So when I looked at that, then I did developed a little case study, and I said, okay, oh, come on here now. There we go. Sorry about that. So then I took some more information from the National Private Duty Survey, and we know that the median-sized company is $1,099,000 in revenue and serves on the average of about 140 clients. From our research that we did in another survey, we found that with $1 million company, the average revenue per client is about $7,799. And so if we were to look at an average conversion ratio of 31%, and we were to increase that by 15%, that is 15% of the 31, that would take our new conversion ratio up to 37%. That would get us 168 clients, and when we do the math, that ends up being a $211,000 increase in revenue with the same number of inquiries coming in. So we're not spending another penny on marketing, just using the inquiries that are coming into your business, and you're able to see significant increases in revenue. So with that kind of a case study, then we begin to look at what is it that we need to do to really get those outcomes. And that leads us then to this question of who is the caller. And some of the research that we have seen, and we've worked with some companies who have actually calculated that, suggests that most of the time the person making the call coming into your agency is going to be the oldest daughter. And we've seen a couple of cases where this number ends up being about 60% of the inquiry calls coming in are coming from the oldest daughter of the client. Then we go down to another daughter. Barbara told us about her role when she was the daughter-in-law, and her father-in-law was ill and basically passed away. And then it goes on down from there to son, spouse. And then in terms of referral sources, how many calls come from referral sources is really going to be a function of your marketing process. Are you focusing on consumer marketing, or are you focusing on referral marketing? And we're going to have more webinars in our series talking about the differences between consumer marketing and referral marketing. But when we understand that most of the time the person who is calling is going to be this oldest daughter, so then we begin to look at the demographics of what does it look like for the oldest daughter. And we actually have talked to a number of our clients who have studied the callers and the oldest daughter and looking at the ideal. And as a matter of fact, we had one of our clients that developed a postcard mailing that went out to this demographic of professional females. This would be doctors, lawyers, bankers, corporate executives, between 45 and 65 years of age who earn $100,000 a year per more. And so you look at that demographic, and that fits in with what we might call the ideal caller. We add to that most of these folks are well educated. Obviously, when they're calling, they care a lot about mom or dad, but many of them, in some instances, have more money than time. They're busy professionals. They probably have their own children and other family members, and so they're looking for a company that's going to give mom and dad peace of mind and quality of life and independence, and is going to take some of those issues off the worry list. And so those are some of the demographics of the things that we're looking at when we go into this. Now, we then look at what is it the caller is looking for. And Barbara and I were talking about this based on our research and based on her experience working with home care companies, working with senior living communities, but also being the daughter-in-law of somebody who needs care. So Barbara, talk to us a little bit about, from your experience, we say that the caller is looking for care and honesty and trust. What does that mean, and how do you assess that when you're taking these inquiry phone calls?
I think it's real important, Stephen, and everyone, that we remember that the person who's calling is looking for so much more than they are able to articulate. Many times they're ignorant, even though they're very well educated. As we looked at our ideal, they're still ignorant about what we can do and what a difference we can make in their lives. You also have to take a step back from those questions that they ask you, and so often they'll say, well, what does it cost? Or tell me about your services. And that's not really what they're looking for. What they're looking for is for somebody to understand that they are having a hard time letting go of this role that they have of being responsible, or they're having a hard time accepting the role of having to be responsible for someone in their life who has always been responsible for them. That reverse of roles where they're now parenting their parents. The family, in some cases, doesn't want to let go of the situation, but they also don't want the situation. We have to remember that they are really looking for support, not just for their loved one. And this is where I truly believe that each and every one of you can set yourself apart from your competition, is if you start to show that caller what you can do for them personally as well as for their loved one. And so this caller is looking for somebody who is going to be a surrogate daughter or son to their parent or their loved one. And that comes through with all of these qualities that we have listed here. But most important, if you can come across with a true understanding and passion for caring about their loved one, that's where you're going to answer their questions very honestly. You're going to begin to truly develop a trusting relationship. And as a result of that, they're going to start to have peace of mind because of the fact that when you say you're going to be there, you're there, and that you provide the care that you're promising them that you have. And while most people ask us, what does it cost? That's really not the most important thing that the caller is looking for. I'm not saying it doesn't play a factor, but I'm saying it is not the primary reason or the primary deciding factor, but yet very often it's one of the very first questions that we get when we call.
Well, that's interesting because we've seen the same thing, Barbara, is that oftentimes people are, and there certainly are those Walmart shoppers who are only wanting on a price, but for the ideal client, the ideal caller, we're looking for folks who are looking for these other things. Now, on the top of our list, Barbara, we put this word care, and I know that means a lot of things to a lot of different people, but as a consumer of senior services and as somebody who's really an expert in this inquiry and intake process, both as somebody who's worked in that field and somebody who's done hundreds of mystery shopper calls, how would you describe this word care? What does that really mean in the context of the daughter, and how do we know if we're demonstrating that?
I think the best way to determine whether or not you're demonstrating it is how much time is spent on the call where your employee is talking versus listening. So often it's pretty much 80-20. Somebody says, tell me about your services, and we go into this data dump and we start to just give them all the information about our company. But we've never taken the time to ask them the question of what they're looking for. And when folks do ask a question, open-ended question, too often it's only a question for them to then be able to tailor what they share. As an example, tell me about your mom's situation. You get a little bit of information, and then you move on to giving them the services that you can provide for that particular situation. But we don't take the time to learn about the entire family. And that's where you can help to show how much you care, is when you ask many, many questions that are going to be related to, and I like to equate it to painting a picture. If you want to describe the situation, a painting to someone, you've got to truly go into a lot of detail about the color, about the definition, about what's in there. And that's the same thing that we have to do when we're on the phone. We have to be able to, when we hang up that call, go to one of our colleagues in the office and just be able to re-describe the entire situation. And if they ask us a question about that situation, we have to have enough information, gathered enough information to be able to answer it. If we do that, and we do that empathetically and watching your tone of voice, so much can be shared just in the tone of voice that you're using, but also it's that listening. I can't stress enough that, Stephen, we have got to listen to what our callers are saying to us, and we have to ask open-ended questions to enable them to share that information.
Okay, well, that's great, Barbara. I really appreciate you setting the stage, giving us that sense of the caller and what care means, and building honesty and trust. And so we're going to dig deeply into some specifics of how to do that. But before we do that, we're going to just take a moment and pause for questions. We typically do that once in the middle of the program and then once again at the end, and we'll go as long as anybody wants. So if you have any questions about the conversion ratios that we talked about, the case study, the ideal client, what that ideal client is looking for, we're going to take a few moments and ask some questions. So Jill, again, would you jump in here and remind us how they will go about putting their questions into the system?
Sure. If you go to, on your participant control panel, if you go down towards the bottom, there's a questions box. And if you just expand that box, there's a spot where you can enter your question and hit enter, and then I will read the questions as they come in.
Okay, so if you have a question about anything that is important, just go ahead and type in your questions, and Jill will read those questions and we'll give Barbara an opportunity to answer, and I may have some response as well. So let's go ahead and do that. Jill, do we have some questions that have come in?
We do. We have a couple so far, and first one is from Jill, not me, and it's, how long should the typical inquiry call take? 5 minutes or 30 or anywhere in between?
Great question. What's your experience with that, Barbara?
My experience is, the answer is yes, right in between. 5 minutes is never long enough. 30 minutes gets way too long. The average call, and this is now taking a call that we want to end with, at the end of that call, you have scheduled a home assessment. Should take no more than 15 minutes.
Okay, good.
All right.
Another question.
This is a question from Jenny. And she asks, how do you ask too many questions without being too overbearing and nosy? Some people don't want to, discuss the situation. Some people don't want to discuss the situation, sorry.
And that's true. And you'll find you have many, many different types of callers. And some you ask an open-ended question, and while you're trying to stay within the ideal of about a 15-minute call, this person goes on and on and on, and 30 minutes later you finally get to ask another question or try to summarize what they said. And then you have the opposite, which is what I'm hearing in the question that we were just asked, somebody who's like pulling teeth to get them to tell you anything. What I have found in my experience, the best thing to do is to actually script, write down the words that person uses. So if you ask them a question, tell me about the situation, and their response is, my mom needs help, and that's all they give you, take the word that they used and say in response, what do you mean when you say your mom needs help? And so I have to get to a person who's very, what I'm going to call closed. That's the way I have found success, because now I'm getting down, talking their language, and just asking for more clarification on something they've already shared. And I find that makes them feel less pressured by me kind of firing. I don't want to keep firing questions at them, because then they may get defensive. So use their words.
And that's a great lead-in, Barbara. We're going to, in the second part of the program, look at a specific sample of an inquiry form and an inquiry log, and there are some sample questions that are designed to engage the caller, and we'll give you those specific examples when we get to that point. Another question, Jill? Do I have another question, Jill?
Sorry, I was muted so you didn't hear background noise. Yeah, I do. Sorry about that. A couple people have said that they're having a hard time hearing Barbara, so if you could pull your mic in a little bit, maybe.
Okay.
That's perfect. That's better for me. Hopefully people can let me know if it's better for them, and we'll move on. I have a question from Lori, and she asks, how do you keep a caller on the line when all they really want to know is the price?
Actually, Stephen, if you're in agreement, I don't want to not answer that question, but I would like to table it because we are going to discuss specifically what to do about the person who only wants to know about price a little bit later in the webinar.
Yeah, let's do that because we have a specific slide and a specific script that we have prepared for that question. So let's put that question on hold, and we'll get to it toward the end of the program.
Okay, sounds good. I have a question here about the case study, so we'll go to that one. It's from Susan, and she said on the sample case study you referenced a 31% conversion ratio, different from the conversion rates on the previous slide. Can you clarify?
Yeah, I was just pulling an example. I think it was 34% was the median on the all companies, and so I just pulled out a number here that said, okay, if your conversion ratio is lower than the median for all of the benchmarks, and that gets us to this 31% number, and 31% isn't bad relative to the median, but it's lower than that, and we say, okay, we're just going to have an improvement of 15%, that is 15% of the 31, that takes us up to 37, and we do the math in terms of the number of new clients, the average revenue per client, and that gets us another $211,000 in revenue. And again, this is just a hypothetical. What if we were at 31% and we were able to improve it to 37%? And again, when you start looking at these kinds of numbers, you can see pretty clearly that if you apply some of the principles that Barbara is talking about and you really develop the skills, make sure you have the right person answering the phone, you're talking about some pretty serious increases in revenue that can come from this process. But thank you. Good question. Another question?
Okay, we have a question from Debbie, and she asked about the case study. I don't think you need to go to the slide, but okay. She just asked what area of the nation was the conversion ratio studied in?
That's a great question, Debbie, and the answer is that the 2012 study, which was using 2011 data, had over 550 participants from all across the United States. So it really is a pretty broad slice of the geography of the country and therefore the demographics of all private duty companies out there. The study itself does have some of this data broken down by geographic regions, and so you can go to the study, and actually if you want to look at a copy of the report, you can go to privatedutytoday.com/benchmarks, and that will take you to a page on our website that has access to this particular study. So privatedutytoday.com/benchmarks, and you can see where to get a copy of this benchmarking study. Another question?
Sure, I'm trying to sort through these. A quick question from Tom, and I think he's mostly looking for a clarification. He asks, why are we discussing an ideal caller since an ideal caller doesn't usually exist?
I think that's a great question. And the reason that I put this up there is because we saw this example of a marketing process where people reached out specifically to this demographic. Professional females between the ages of 45 and 65 who earn $100,000 a year. And so I threw this up because while we're talking about not spending more money on marketing, it does give you an opportunity when you understand the ideal caller to target your marketing efforts to reach out to this this target caller, this target market. And the more that we can link together our outbound marketing efforts with this process of handling inquiries and referrals and converting them to admissions, we really do a much better job of growing our company. And as I have studied literally hundreds of private duty companies, and I have seen companies that have a much higher revenue per client than the average, I see that this is sort of the demographic that they're reaching out to in their marketing efforts, and that they're doing a good job of converting those inquiries into admissions.
Now, I'd just like to add to that, Stephen. I mean, while we have that ideal caller, the strategies that we're talking about here, we don't really, quote, need for the ideal caller, because that will just happen. The strategies we're talking about here are the ones we need for the more challenging caller, the caller who's going to be putting up all these different roadblocks that you now have to work your way around to be able to get them to be part of, your client. And so we go way beyond the ideal caller, and what we're talking about here and the strategies that I'm honing in on from what I've learned is for the non-ideal. It's for the more challenging caller that we have to deal with on an everyday basis.
Great point. Thank you, Barbara. Let's take one more question, if there is one, Jill, and then we'll get back into the rest of our content, and then we'll take more questions at the end of our time.
Okay. That's good, because I think we have one more, and then I think the rest of these will probably be covered as we move along. So this is a question from Ryan, and he asks, would increased amounts of money spent on newspaper advertising versus money spent on referrals change the types of calls coming in and impact the inquiry ratio? Could this increase the amount of calls coming in for services we don't offer, such as Medicare?
That's a great question, and you've really hit on the answer in the question, and that is we have been able to look at the difference in conversion ratios from calls coming from consumer marketing versus calls coming from referral marketing. Now, let me just clarify. When we say consumer marketing, we're talking about newspaper, radio, television, website, social media, all the kinds of things where you go out directly to the consumers, versus referral marketing, where you're reaching out to healthcare providers such as doctors and hospitals and skilled nursing facilities, or you're reaching out to what we call trusted advisors, which are bank trust officers and elder law and estate attorneys and geriatric care managers. And as you said in your question, the answer is yes. We see a much higher conversion ratio for those calls coming from referral sources versus those calls coming from consumers, and we also see a much higher revenue per client coming from those referrals. And that's one of the reasons that in our marketing programs we really encourage private duty companies to make a clear strategic decision about whether they're going to focus on referral marketing or consumer marketing. But in either case, once you get the phone to ring, then it's important to apply these principles. And I think that takes us then into the next step. And so let's go back into our content. And as I mentioned in the introduction, Barbara, in her business, Training Unlimited, does mystery shopper calls for home care companies, in which she calls into the company. And well, Barbara, you tell us more about it. You've done, how many hundreds of these have you done?
I have no idea. I don't want to tally that number up. But what's most interesting to me about this mystery shopping is we believe that each one of our employees is answering the phone and handling the calls just as we have shared with them that we want them to do, that they have a wonderful greeting, that they're upbeat, friendly, nice. And unfortunately, that is not the case. And there have been times I have picked up the phone to make a shop, and the first word out of the person's mouth is, what? And I kind of go, excuse me, have I called ABC Home Care? And they go, oh, yeah, I'm sorry. Because it was an after-hours call. They were out doing something else. They didn't pay any attention to the fact that this was a call coming in from their business. So number one, with the mystery shopping, any call that's made after normal business hours has very often been handled extremely poorly. And I'm not saying the person has to, be in an office the whole time after hours, but they do need to be able to focus on the caller when they come in. And those first words out of the person's mouth make such a difference in how they're said for the way the rest of the call goes. The other thing I've learned in my mystery shopping is the caller themselves is often very much in control of the call, asking all the questions, and the employee is just answering those specific questions. When they do ask questions, too often it begins to sound like they're actually prepared to do an intake and start saying, does your mother use a walker or a wheelchair? What kind of medications is she on? What are her other illnesses? And I'm like, we're not at the point of an intake. This person is calling for information about your services. And when they ask you the question, tell me about your services, too often on the when I do my mystery shops, I get this data dump, just this massive regurgitation, and a lot of times I can tell they're reading from a list. What is not happening on the mystery shops is people are not asking me about the situation. I did one yesterday, and it was very interesting to me because they began talking to me as if I was looking for services for myself. And finally, I said, I'm not looking for myself, I'm looking for my mother. And they went, oh, and they weren't sure how to handle that because they never assessed the situation and found out what was going on. They did not involve me in the call. And if you change one thing about what your staff do, and you change it right now today, before they hang up that phone, they need to ask for the in-home assessment. On my shops, what's happened is I have been told that the next step in the process is that our nurse or whoever would come out, or our specialist or our home care person would come out and do an assessment, a free assessment in your home. But they never asked me if I wanted to set up a time to do that. And I think if we just look very specifically at the few things we have listed here, if you have a positive, upbeat attitude at the beginning of the call, you take control of the call and not let the caller control it. And if you learn about the situation and actually before you hang up the phone ask for an in-home assessment, I think you'll find a tremendous difference in just those few little changes.
And so as we look at that, I know, Barbara, you've had lots of experiences with working with companies and found that after your assessments, your mystery shops, you're finding that the person that they have answering the phone just is not the right person. They're not going to work out in that role. How do we go about having a conversation with the owner of a company about the necessity to sort of prune the dead wood if they have people that aren't performing and probably don't have the skills or the attitude to do that well?
Well, what I have found is that a number of owners are really aware of the issue, which is why I became involved with them. They know something is not right, and many times they can actually put their finger on it and say, it's this person who's answering the phone, but I can't get rid of her because she started out the business with me, and I wouldn't be where I am if she hadn't been there with me for the last 10 or 15 years. Or it may be that, well, that's my co-owner's daughter, and I can't get rid of her. She's got to be part of this. And that's fine that you've got people who are good, but what you have to look at is, are they good for the role in which you have them placed? Answering your phone is the most important job in your company, because if they don't answer that phone properly, you're not going to get the business. So if you have somebody who is in that position and you're thinking, maybe, maybe not, maybe this is some of the dead wood I need to prune, I would begin by sitting down and talking with them and saying, what do you like best about your job and what don't you like? Very often, someone who is not good at answering the phone and taking the inquiry calls will admit that this is not the favorite part of their job. They will share with you what other aspects they do like. If you choose to keep them in the role that they're in, because for whatever reason you do not feel a change is politically correct at that moment, I recommend that you set specific examples and expectations of what you want from them when they answer the phone. And put it down in writing. Put it down in writing with a timeline for when you expect change. As an example, you may have an employee who answers the phone very pleasantly, but never identifies themselves. We'll say the name of the company, we'll say good morning, but then we'll never give their name. Yet it's important that they do give their name to begin to develop that relationship. So you make that one of the actual objectives that they must do, and you have this in writing that they will now begin to do it. You then have an opportunity to provide some coaching, be right alongside, listen when they're on the phone. And if you don't hear them say their name, as soon as they hang up the phone, say, I didn't hear you say your name, Kathy. Next time, let's remember that. But it's going to take, you're trying to change some habits. If these habits don't change, if by providing the coaching and support it's not working, and you sit down again with this person, which in whatever timeline you've established, then the two of you together will be able to identify, I'm not in the right role. And that's when, and sometimes it's hard, but because you've given them every opportunity to succeed and they haven't, then you know it's really time to prune.
So we've had this conversation with somebody, that person is either leaving the company or going on to a different job in the company, or your company is growing and you need to add somebody to take inquiries. And so we talked here about selecting the right inquiry specialist. Tell us about some of these criteria that we have on the slide here, Barbara, that you think are really important in terms of selecting the right person to take those phone calls.
I think it's extremely important that you look at two sets of skills in an inquiry specialist. One set of skills is something that I refer to as they have to be innate. And those are the criteria you see there. By charming, I really mean that they have to come across as sincere, as honest, as caring, all those different qualities that we were talking about what the caller was looking for. And if they can come across that way and appear really interested in what's going on in that caller's life and not taking that call and feeling like it's a rote call or assuming they know what's going on because they've had so many situations similar to this before and jumping to conclusions, they have to continue to be interested and curious about each and every caller. And the only way to do that is they need to know how to zip up their lips. They need to know how to shut their mouths and to really listen to the caller. And when you're really listening, you're not thinking about the next question that you're going to ask. And so you're really listening from your heart. How somebody comes across on the phone is critical. A lot of times we begin the interview process for a new employee by meeting them. We may have them fill out an application, we may look at a resume, but then we set up an appointment, we have them come in to meet. If you are looking for somebody to answer your phone, I suggest that you start with a phone interview yourself and see how does that person sound on that phone. Ask them some very leading questions. You know, what characteristics do they feel has made them a success? What are the things they feel confident in doing? How do they motivate themselves? What would they describe as their ideal job? If they've applied to be an inquiry or to answer your phone and be the inquiry specialist, and they start describing an ideal job where they're working alone in an office and not on the phone, you know right away that you don't have the right person there. But when you do look at doing this interview on the phone, how did they come across to you? Did they sound professional? Did they sound motivated? Did they have the right tone of voice, the right attitude? Is this an attitude that you think could be kept up, or is it only because they're looking for a job? But the third thing I recommend when you're on the phone, number one, do it on the phone. Number two, make sure that you ask really good leading questions to get to the heart of, you know, are they charming? Are they really interested? Are they curious? But then I want you to go into a role play with them. And they may not know about your business. That's okay. But slip into a role play of anything that they know. You want to hear what they say to your questions. Do they let you control the call? Do they ask for more information? What is their sales experience? If you find that somebody has the characteristics that we have listed here, then they're a good bet that you can train them to do the actual steps of a call. But if they don't have these criteria and it doesn't come across on the phone, then I would move on to your next applicant, because that person in the long run is not going to be the right fit for your inquiry specialist job.
That's excellent, Barbara. Thank you for those insights. And as I'm thinking about many of the calls I've made to home care companies, and of course I'm talking to home care companies every day, there's two things that I find are troublesome for me. One is the company where the owner went out and found somebody who was a really good administrative person and then said, oh, by the way, your job is to answer the telephone, and they've never really been selected for their telephone experience, and they've never really been trained. The other one is the surprising number of companies that I call where the person who answers the phone does not speak the English language well. And I know there's a lot of interest in diversity, and of course there's a lot of diversity in the home care industry. But Barbara, help me to understand this a little bit about the importance of speaking the language well, not just having a good voice, but articulating and speaking the language well, and how so many companies make the decision to put somebody on the phone that does not appear to speak the language well.
Well, you have to realize that there are times that the caller themselves is a senior, and they already have difficulty understanding. And I'm okay. You know, when we have a language barrier, that just makes things much more complicated for the potential client, and you're going to lose business if they can't understand what's being said to them. It's also like many times we'll use terminology. We'll say, oh, well, we can send out a CNA. Or do you have, you know, and we use all these acronyms, even things as simple as an RN or an LPN. A lot of times our callers do not understand that. And we have to realize a caller is very, I don't want to use the word afraid, but they're almost afraid to ask you to repeat. And they may ask you to repeat something once, but if they don't get it the second time, they are not going to ask you to repeat a third time, because at this point now, it's not really fear, it's embarrassment. And they begin to blame themselves for not understanding. And so that it is so important that the language be clear, that the person, your inquiry specialist, be able to articulate, and that the English that they do use is proper English. Otherwise, and I will go back for a moment to the ideal caller, because if the ideal caller is dealing with somebody who doesn't understand the English language, unfortunately in America, a lot of times that's going to equate to a lack of an ability to trust. Because even though this person may be very caring and very wonderful, it's not coming across simply because of the language barrier. So I think it's extremely important that we keep that in mind, Stephen, that it's just, we have to look at it from the caller's perspective.
So selecting the right person to answer that phone becomes a really critical element of this process. Now, one of the things that we know is that as the company grows, it's not possible to have just one person answer the phone every time it rings. They're going to be on one line and another line rings. They're going to be out of the office. They're going to be on vacation. So we talked about this idea of developing your answer order. Determining who's the first person and the second person and the third person. Barbara, talk to us a little bit about how a team of people in a home care company can have this conversation and really determine the sequence in which different people in the office will answer the phone if the primary inquiry specialist is not available.
I think a lot of times if we bring it up at a staff meeting and we talk about, we say, okay, you know, if Chris is out of the office, who's going to be the next person to take that inquiry call? And of the 6 people in the staff meeting, 5 of them turn their heads away and they no longer look at you as you're speaking. You know right then and there that those are the 5 people who are not comfortable and not ready to step up the plate to be on the phone. And it may be that you think one of those people is the best person. We need to increase their comfort level. And the best way to increase their comfort level is to provide them with good, solid guidance on what your expectations are, how they can answer the phone, how do they handle the difficult caller. Nobody is afraid to take the phone with somebody and just answer questions. they're afraid to try to get to assess the situation. And I think if we give them the confidence level, that we'll be able to have more of our team willing. But in determining right now, looking at the team within your office, there's many different ways to do it. One of the ways I like to do it is to ask for volunteers, because those that volunteer are typically going to be the ones who are better at it. If you have no volunteers, then provide the opportunity for that mentoring and coaching. I would also take a real hard look at not transferring the call. Many times we have a receptionist who answers and then they transfer it, and they've transferred according to our answer order. I really encourage you to have whoever picks up the phone be the one to handle the call. In order to assist them in their comfort level, I also think it's important that they know if they're having difficulty on a call, that they ask the caller to hold, getting a name and phone number, and they get somebody who is more comfortable with that type of caller. Some callers are easy to deal with, others are more difficult, and our personalities really play into which callers we're comfortable dealing with, and that also affects your answer order. So to summarize, I truly believe, looking at your team, you know which ones are the best order to answer, and sometimes it's the person in the back who you didn't think was going to be great on the phone is really turning out to be dynamite every time she picks up the phone. Encourage her or him and give them the skills that they need to be more successful and to be on the phone, and put them in the line.
We're going to take that to the next level. In a moment, we're going to talk about logging calls and using the inquiry form. And one of the things I would add here is that you can really look at tracking the calls coming in and the conversion ratio by individual, and you really get some quantitative indicators of who's the person that does the best job on the phone of actually converting inquiries into admissions, because that really is the ultimate test of who's successful in getting the caller to agree to let us come out and sit on the sofa and evaluate their situation. Well, you do a lot of training, Barbara, of team members in home care companies to do this process, and you've created this anagram called CARE. Tell us a little bit about this and what's involved in training members of your team to be excellent on the telephone.
Well, I think it's important, and I go back to my passion and why I got into the business was truly because I wanted to make a difference in someone else's life, and a difference in the caregiver, and not as the caregiver, but the care recipient. But at the same time, I wanted to make a difference with that adult child. Hence, and I'm a big acronym person, so I began to think about what was it that I did on my phone calls when I first got into the home care business to make a difference and to be a success, so that my conversion rate was very, very high and above the norm. And I realized that I did on every call 4 different things. And this is what I encourage every one of you who are part of this webinar, that you train your teams to do. And the reason I make it 4 simple steps is a lot of times the person who is really, really good on the phone is not a real PhD level educated person, but they do have this compassion and ability to make a difference and to do very well and convert our callers, our inquiries, into new clients. So if you each go back and share with your team these 4 steps and remind them, just think, every time you pick up the phone, all you have to do is show the caller that you care. Number 1, connect with them. Learn about, what's going on in their lives, and assess the situation. And I combine connecting and assessing together because you're doing both simultaneously. Part of connecting is that first positive impression. It's really being upbeat and positive and warm. But as you're doing that, you're also asking those open-ended questions. And the easiest way for us to help our team know whether or not it's an open-ended question is just ask them. If it can be answered with a yes or no, it's not an open-ended question. You want the, tell me about, how does this work? What's going on? But no, do you want services tomorrow? Does your mom use a walker? Stay away from yes and no. Thirdly, we need to partner with the caller. We can't tell them, here, this is what you need. We must work with them to find the solution. And that's why the third step on the call is we actually need to resolve whatever problem they have presented to us. And then lastly, we finally engage them in services. Now, for execute for me on these calls, on the initial inquiry call, your goal is to set up that home assessment. And that's by asking the question. I call them confirming questions. You have to ask the question of, when would be a good time for me to come to your house to do the home assessment? Would Tuesday or Thursday be best? Don't say, would you like me to come to your home to do a home assessment? Because that's a yes or no. And if they say no, then you're backed into a corner. So every time a call comes in, tell your team and train them that they need to show the caller they care. They got to connect with them, assess their situation, help to resolve their issues, and then finally actually execute or really schedule an assessment. And you need to do that on a regular basis. Bring it up at every staff meeting. When you hear different calls going on, present to your team, here, I heard this great call. Let me share this example of that Susie did on this last call. She did a super job of resolving the potential client's concerns and issues, and as a result, we have the home assessment and a new client. So it's 4 steps that I just really live by.
And so that takes us then, Barbara, to using the inquiry form. And when we wrote the Capture the Caller book, we took your experience and my experience and combined it together and created this sample form. Talk to us a little bit about the kinds of questions that we put on the form and why we specifically recommend this form and not the intake form where you're asking for clinical information and do they use a walker and what are their meds? Why these engaging questions?
The reason for the engaging questions, the reason for having an inquiry form with questions on there is because if we're truly listening to the caller, we will get into their story and sometimes, quote, forget where we want to go next with the call. And we need a lot of times a visual to bring us back and to refocus. We must maintain control of the call and not let the caller walk away and ask all the questions. We have to guide it. If we're going to stay within a 15-minute call, we have to make sure that the call is going where we need it to go in order for us to get the home assessment. If we have questions in front of us, we don't have to be thinking about what the next question is that we're going to ask. And as I did my coaching, one of the things that folks had a lot of difficulty with is they said, I didn't really listen to what the caller was saying to me because I was thinking about what the next question was that I was going to ask. And that would just raise red flags for me all the time. And that's why this inquiry form was developed. And it takes you through the 4 steps in the process. And it ends with, you know, hey, we've got to have that referral source there because you also need to know where to spend your marketing dollars. And if that question is not asked, you don't know where to spend your dollars. And I got to tell you, on my mystery shops, that question is not asked.
And what we've learned, I'm sorry, Barbara, I just want to jump in there. You're talking about these referral questions. What we have learned over the years in talking to hundreds of folks is that you can't just simply ask the first question here, where did you hear about us? That's an important question. But we realize that most of the time when somebody calls your company, they have heard about your company in at least 2 different places. And so the first question, where did you hear about us? The second question, where else have you heard about us? And so maybe they say, well, I saw your flyer in the doctor's office and then I looked at your website. Or the discharge planner at the hospital told me about you and then I also asked my friend whose father had had some home care and she gave me your name as well. So where did you hear about us? Where else did you hear about us? And then some other folks said, we also asked the question, where did you get our telephone number? Because again, that helps us to understand where people are actively looking. And as Barbara said, this information becomes really critical in guiding your marketing efforts. And again, it goes back to the great question that was asked earlier about, well, why do we put up there the information about the ideal caller? Because when we evaluate the responses to all of these questions on the inquiry form and tie it back to our marketing efforts, now we're able to refocus our marketing efforts to generate the kinds of calls that we think are best for us that are going to help us grow our business. And so using this form becomes a really important part of the process. And then down here at the bottom we have the information on the assessment. As Barbara said, you ask for the assessment, you get a date, you get a time, you get the location information, and you schedule it. The next thing that we talked about, Barbara, was the idea of tracking this and using the inquiry log. From your experience, both working as somebody on the phone and also from your mystery shoppers, why is it important to track every call and to then analyze those results?
We are finding that too many companies do not track, and the loss of business is absolutely phenomenal by not following up on the calls that came in. Many times the call is ending with, "Call me if you have any more questions," and the name and phone number of the person calling has not even been gotten. And I think by tracking, it will require everyone to get that basic information and then to go back and follow up. You know that when somebody calls your company, they're going to call at least 2 other companies. Your goal, even if they have started services with another, is to still get them as a client. And if we haven't kept track and know what's going on, we can't call them back in 3 months and say, "Hey, are you happy? Are things going well?" Because you've had people come to you who are not happy with another company. And the tracking it's just amazing to me. If we don't really take a look at and analyze where did the calls come from, how many were we able to convert, then we're just losing business. And so, Stephen, I'm sorry, but I guess I'm pretty passionate about if you don't really keep track. It's kind of like if you don't have a roadmap, if you don't know where you're going, you're never going to get there. And if you're not analyzing and taking a look at what's happening with your business, how are you going to grow it?
And here are some things that we've seen folks doing with that inquiry log. Obviously, the conversion ratio from inquiry to assessment and from assessment to admission, but also looking at inquiries by referral source and inquiries by marketing method that will really help you validate your sales and marketing activities. We also mentioned earlier about having each person who answers the phone keep their own log, so then you can actually look at the conversion ratio by person, by phone answerer, and you can also use this to help track lost opportunities. So we're adamant about making sure that you use the inquiry form, ask those questions, document the results, schedule the assessment, and then transfer that information to the inquiry log so that you can evaluate it on a monthly basis. Now, one of the questions that came up earlier, Barbara, was this question of how do you deal with price shoppers, with the Walmart shoppers who are only interested in price. So somebody calls up and says, how much do you charge? And you try to get some questions in, and they say, oh, I don't want to answer any questions, I just want to know how much you charge. Barbara, walk us through how we can handle that particular situation.
Number one, too often when somebody calls and says, how much does it cost? That immediately puts us on the defensive, and our gut tells us just answer the question and we can be off the phone. I want you, with everyone who asks the question, what does it cost, I want you to acknowledge and divert. And by that I mean I want you to indicate to them that you've heard their question, but that you can't answer it without more information. As an example, they say, well, what does it cost? Say, I understand you're really interested in price. Our price varies based upon the services that are needed. Tell me a little bit more about the situation. They come back at you and they say, I just want to know how much it costs. Well, our price does vary depending on whether you need what we refer to as companion care, if you need personal care. We do have different rates depending on the level of training of each. Whatever your scenario is, tell me a little bit more so I can give you something accurate. After you've done that twice, and they ask a third time, and they're just really being very persistent about the price, we need to give them the price. But the way I recommend that you do that is that you say, there's a lot more about our business, and you come up with whatever scenario you want or however is comfortable for you to state this. There's a lot more than just price. if price is the only thing that's important to you, I can give you a list of the 3 lowest price companies in town. We are not the lowest price company in town. I believe we are the absolute best because of all the additional services that we provide, the level of training that we give our caregivers. But I can give you the price of the lowest 3 companies in town. What's your name and number? What's your email address? I'll be happy to share that with you. But I'm also here for you because I know this business. I know what it means to have and to be involved with a loved one. I want to do what's the best for your family. I want to help you. And if we go into that type of a, don't get defensive, really be there for them, give them the 3 lowest prices if that's all they want. It's amazing how we can turn that call around into, well, price isn't the only thing that's important. What do you mean when you say, and we get them talking. But so that to deal with price shoppers, it's divert, it's acknowledge, and then divert. But after 3 times, you're just going to get them angry if you don't give it to them. So you got to give it to them.
And it's interesting how many times when we give them those 3 low-price companies, they will call all of those companies, and then they find that they're not able to get the level of quality, the caring, the peace of mind that they were looking for, and they will come back to us. So don't be afraid to put together that list in your local market of do your research, do your own mystery shopper calls and find out what other companies are charging, and keep that list handy of the 3 lowest prices. And quite frankly, you'll blow the caller away when you offer to send them that list. Well, we've used up our 60 minutes of time and then a few. So let's, again, pause for questions. We respect that we've invited you here for 60 minutes, and that 60 minutes is passed. So those of you who need to leave, we certainly understand. But we're going to take some more questions, and we're going to stick around as long as anybody has any questions. So, Jill, let's go back to the question panel and see what questions people have for us, and we'll let Barbara respond to those questions.
Sounds good. We have quite a few questions here, so we'll get rolling. A question from Melissa, and she asks, how do you handle inquiries when the caller seems to be in a hurry, but they really want the information?
When the caller is in a really big hurry, it sounds like they're really just gathering. All they want is, as you said, the information. That's all they're gathering. Get the phone number, get the name, the phone number, and schedule an opportunity to call them back. If they say, no, I just want the information, just give me the information, you can't give all the information over the phone very quickly. When you do that, what you have to realize, your caller is going to remember 3 things when they hang up the phone. So you're going to have to think about what 3 things are most important for them to remember. And those are the 3 things, the 3 pieces of information that you give them. Now, you know all about your services, and if you try to state everything, our tendency when somebody is in a hurry is we talk fast. And that's the wrong thing to do. It's to ask the questions and say, I understand you are in a hurry, but we offer so much. Tell me a little bit about your situation so that I can give you the information that's relevant to you and to your situation. So if you keep in mind, get name and phone number, and even if you can't schedule a follow-up call back and they want the information now, narrow down the information that you're giving them, and then even if you haven't scheduled a call back, call them back in a day or 2 and follow up with them.
I would add to that, the other thing that you can do is ask the person for their email address and offer to email them some additional information, and then put together a series of PDF files of promotional information about your services organized in the way that you want it to be organized, and you can follow up with an email and attach a PDF, and more people are happy to get information that way. Let's take another question, Jill.
Okay. Going back to the case study, Frank asks, on the slide it says clients served is 140, and he just wonders if you could clarify if the study is done over a course of an entire year, or is this the average of the clients at one point in time?
This is a study that's done once a year, usually begins in the middle of January and runs through March, in which company owners go to a website, and the first thing they do is download a worksheet, and they use that worksheet to capture information about their company for the full calendar year. So the data from the 2012 study was from January to December of calendar year 2011. About 500 and, as I said, 550 some people participated in the survey, and so what we know then is that the median revenue for all the companies that participated was just over $1 million. The average number of clients served was around 140. Now, obviously, if your revenue per client is higher, you're going to have fewer numbers of clients. So these are either median or mean numbers, depending on which statistical approach was used. But it is a national survey, and the data is collected one time, but it's for the calendar year 2011. Another question or a follow-up to that?
Trying to see if there's any other about the... Yes, from Kelly, and she asks, I'm curious if the company's reporting their conversion rate count is every incoming call. Our rate is consistently 26 to 28%, but we do not qualify the caller before counting it.
That's a great question, Kelly, and my experience is that most people do not track every single call. And so while in the benchmarking study we ask people to tell us what percent are converted from inquiry to assessment and what percent from assessment to admission, we know that probably a lot of those people are not tracking every single call. So that's a great question. And the thing we know about doing this kind of research is that this is the best data that's available, but we know it's not 100% precise because it's based on 500 and some people answering the question their own way. Another question?
Sure. It's on the same topic, and it's from Tasha, and she wonders if you could state the percentages of the conversion, whether it's consumer versus referrer.
That's a great question, and we do not have that answer because we didn't break it down that way. I'm actually working with Home Care Pulse to design the questions for this coming year's survey, and one of the things that we're doing is asking the companies that respond, do you primarily focus on consumer marketing or do you primarily focus on referral marketing? And so we'll have better information in next year's report. Another question?
Okay. This is from Amber. She has left, but we're still going to answer the question. She said, what would you suggest we call the assessment or intake? It has been suggested that we steer away from that word. I'm not sure.
Read the question again, Jill.
She asked, what would you suggest we call the assessment or the intake? It has been suggested that we steer away from using those words.
Okay, the words assessment.
Or intake, correct.
Or intake. What do you think about that, Barbara? I know as an industry we tend to use those words assessment and intake, but do you have any sense about how people respond emotionally to those words?
I just like home visit. I do not like to stay with technical terms, and I don't like to get into the medical, and intake is very medically oriented. We're in private duty home care is what we're talking about here, and this is all about just being caring and compassionate. I just want to come into the home to help you figure out what's the right thing. So we're just going to do a home visit.
Okay, so if people are uncomfortable with that term in-home assessment, they could say a home visit. We have one client that uses the term caring consultation. We'd like to set up a caring consultation. So again, the language is important, and you can think about the language that makes most sense to you, that you're comfortable with, and you think your callers are going to be comfortable with, to get the essence of the idea that we want to come and sit down on the sofa with you and have a conversation and understand your needs and your situation, and then be able to suggest solutions. Great question. Another question, Jill.
Okay, we have a question from Joe, and he asks, what are you supposed to do if the caller is opening up and you don't want to interrupt? how do you cut them off?
Great question, Barbara.
I don't. I listen. And those are the calls that sometimes will go on for 30 or 40 minutes. But yeah. And when they finally do take a breath, that's when I can get in. But I will not interrupt the stream or the flow of what they're trying to share with me. But I will also try very hard to read between the lines as far as what are they actually trying to tell me, and then paraphrase much more simply back to them to see if I have been able to zero in on what the real concern is.
The other thing that we could spend a lot of time talking about, we don't have time today, is understand the behavioral style of people and the behavioral style of callers. And what that means is if a person has one particular behavioral style, they may be very outgoing and expressive, and they really want to talk. And so they'll talk for a long period of time. There are other styles where people aren't as expressive. Then we also have the style we call the compliance style, where people want lots of facts and details and information. So you may have somebody who's going on and on and on because they really want the details, where there's another style, they just want the big picture. So some of it will have to do with the emotional state of the caller, and some of it will have to do with their natural behavioral style and how they process information. Let's take another question.
Okay. A question from Marlon, and he was asking if you could give some tips on building rapport, and if there are any danger or trigger words that people should avoid on these phone calls.
So if we go back to your training, your Connect, Assess, Resolve, Execute, developing rapport is part of that Connect phase. Barbara, what are the things that you teach about connecting and developing rapport?
One of the first things that I focus on is how you answer the phone, what is the tone of voice and the attitude that you have, what are the open-ended questions that you're actually going to be asking, thinking in terms of an 80-20 rule. 80% of the time you want to be listening, and you only want to be talking 20% of the time. Many of us believe that when we find a common denominator with a client or with a potential someone that we've just met, to really develop that relationship, that we should share our experiences with them to let them know that we have that common denominator. And while that's a great concept, what you need to do is to ask them about the common denominator, to get them talking and you doing the listening. And as far as building the rapport, there is nothing better than just listening. And I mentioned earlier in the program, and I truly believe if you take the words that they use and the concepts that they are starting to talk about and ask for more information on them, it's the quickest way to develop that rapport.
Okay, great. Thank you. Another question, Jill?
Let me see here. Try to get some along the same lines. All right. Well, we're just going to go. Melissa asks, could you clarify, should an agency focus on either consumer advertising or referral sources and not both?
That's a great question, and I have created quite a bit of controversy and stir among audiences in writing over the last 6 months, because I've taken the stand that says I believe that a home care company does need to make a conscious decision to focus on consumer marketing or referral marketing. And what I've said is I've never seen anybody that does both exceptionally well. And when I've said that, then people, particularly in my live audiences, bristle up. And the reason they bristle up is because they're trying to do both, and they think they're doing them well. And so when I say I've never seen anybody do both exceptionally well, then they may take offense to that. But that's the truth. I've been doing this for 25 years and worked with hundreds of home care companies, and I have seen companies that do consumer marketing exceptionally well, and they've grown as 5 or 7 or 8 or $10 million company doing consumer marketing. I've also seen companies that do referral marketing exceptionally well, and they've grown a $7 or $10 million company doing referral marketing. But I've never seen a company of that size that does both. Now certainly even a company that's doing referral marketing is going to have a website. They may do some things to drive people to their website, and certainly the website is designed to reach out to the consumer. So yeah, I'm not talking about 100% one way or the other, but I'm talking about developing a high level of expertise in implementing either consumer marketing or referral marketing. So the short answer is yes, I think you should pick one and focus on that and get really good at it. Let's take another question.
Okay, I have a question here from Tasha, and she says sometimes people are squirrely about giving their name and phone number. They're worried that they will get a sales pitch. How can we get past that?
What do you think,
Barbara?
Barbara?
Question. I think that's a great question, and it's a challenge for all of us. The one that I heard just most recently on a mystery shop call that I thought was done extremely well was the person, gave a very nice greeting, and I said, I'm looking for information or whatever, and she goes, can I please get your name and number? We've had these horrible storms around here, and I want to make sure we've had these difficulties with our phone line. And she was just so sincere and so compassionate, and I didn't even think twice. I gave her my name and phone number without even thinking about it. And so if you have the best way is right there in the beginning. But many people still will not want to give it to you right in the beginning, and I like to equate it with, think about you go into a bar, guy or girl, and you sit down next to somebody of the opposite sex, and they look at you and they say, can I have your phone number? And you sort of look at them and go like, well, no, absolutely not, I'm not. But then you sit there for 10 or 15 minutes, and you both start chit-chat, and you find out you're both in, home health or home care, or you have these common interests, and you ask the question 15 minutes later, well, you're a lot more willing to share at that point. So if you have asked for the phone number in the beginning of the call and they say no, most of the time it is not asked again. So my best recommendation is try at the beginning. If you don't succeed, then do it again at the end. And normally they will be willing to share at the end. If, and here's the big if, you have developed that rapport. If they don't give you the number, you know you haven't developed the rapport. You haven't connected with them. And I share with the folks in my training, if you connect with your caller, they'll give you their phone number, and they will welcome a call back from you, even if you forgot to ask a question that, to truly assess the situation. But if you screw up connecting and you do not build that rapport, they're not going to give you your phone number, and they're not going to want you to call them. They'll be afraid of that sales pitch. So it all depends on how well you connect and build rapport with that person as to whether or not you'll get that phone number.
Okay, another question, Jill.
Okay, we have a question from Tom, and he asks, when do you get to the intake questions in the conversation?
I don't. I do the intake when I go out to do the home visit.
Okay.
And that's an important point there. I want to emphasize that because so many people ask us that when we share this inquiry form, and it's a simple one-page form, and they say, well, what about all the information that I need to do an admission? You get that once you have had the opportunity to sit down on the sofa in the home with the client and the oldest daughter, and that's when you gather that detailed intake information that you need from a clinical perspective. Don't try to do it over the telephone. And we were having this conversation the other day. I was doing a sales meeting with one of our clients, and we had all their 10 offices on the phone, and we were working through this process, and that came up because they were accustomed to using an intake form as part of that initial inquiry call. And the more we got to talking about it, they realized some of the barriers that they ran into when they tried to gather all that information over the telephone. So excellent point, Barbara. Thank you. Another question.
Yep, question from Frank, and he asked, if you cannot get the home visit appointment, what is the best way to ask for following up with the prospect?
If you don't get the home visit appointment on the first call, and that's assuming that you have actually asked for it, the way I recommend is that in that process of scheduling it, if the person is tentative, then do it tentative. Well, let's just put something on the calendar let's see, you said you needed 2 or 3 days to talk to your sister or your brother. And you mentioned that on Thursdays is really your best day. I'm going to just pencil you in here on my calendar for next Thursday, but I'll call you before I come out. I recommend that approach before saying I didn't get a home assessment. But let's say you have attempted that and you tried to put something tentatively on the calendar in pencil, and they still said, no, I'll have to call you back. Then fine, ask them for their timeline for calling you back if they want to stay in that kind of control, and then say, okay, I will look for your call by Wednesday of next week. If I don't hear from you, I'm going to give you a call on Thursday. So even though they want to maintain control for a certain length of time and they don't want to schedule the home assessment, I still will schedule a call back for the time after. If they still say, no, I'm going to call you, don't call me, I will wait and I will say, okay, I respect that. I respect that you really don't want to be bothered, but I do know that we're really concerned about Mom. If I don't hear from you and I start to worry, I may just pick up the phone. That's kind of one of the things I do. I just really get concerned. You've shared an awful lot with me. And again, it goes back to connecting with that caller. They're going to be willing to accept your calling if you've made that connection and have built that rapport. And I may sound like a broken record here, and in a lot of ways I am, because so much depends on that first part of the call. If you get somebody that says, absolutely, do not call me, then I go to the next step of asking for an email, and I begin email correspondence. And a lot of times if someone is unwilling to give you a phone number and doesn't want you to call, they are willing to have you send emails, or they're not as intrusive. And the whole part about getting the business is, I hope all of you are familiar with that term TOMA, top of the mind awareness. But that's what our emails do, that's what our phone calls do. It keeps our company, as they're making their decision on who to use for care for their loved one, it keeps our company at the top of their mind so that when they think home care, they think us.
Wonderful. Another question, Jill.
Excuse me, sorry. Question from John, and he asks, at what point do you give out the pricing? Would you do it during the assessment?
I do not give the pricing until the question is asked. I do not volunteer it. And if it's never asked, then the answer is yes, I do it during the home assessment. Because now I've been out there, we've worked up a schedule, we know when our caregiver is going to come, we know how many days a week, how many hours, and I can say, okay, now here's what the cost is.
The other thing that we have found when talking about pricing is, certainly because we charge on an hourly basis and people want to know what we charge per hour, that's important. But it's also good to have some samples of the, let's say we're going to provide 8 hours a day, 5 days a week. What does that cost, and how does that compare to what it would cost to be in a local assisted living facility or skilled nursing facility? Because we don't want to be competing against the lowball home care company on that list of 3 that Barbara mentioned. We want to be in a situation where they're comparing home care versus going into a facility, because we know that people would much prefer to stay at home. So if the price is about the same, or if the price is less than a facility, then that becomes an easy decision. If the price, if you're doing fairly extensive care and it actually costs more than a facility, then they have to be able to understand the value of being at home. But showing them how much they're going to pay per week or per month is a different comparison than how much they pay per hour. Another question.
Sure. This is from Ryan, and he asks, what pre-qualifiers do you suggest to ask during the initial phone call before setting the assessment?
I guess Stephen, can you help me with what you think you mean by pre-qualifiers?
Well, it may be that he's asking because we do have situations where we have clients who said, we've had to ask some qualifying questions to make sure that this person is really serious, because we were spending a lot of time driving out to do assessments only to find out that they were thinking 6 months down the road, or they didn't have any money, they thought this was going to be paid for by the government, or whatever. So if you're finding that you're getting lots of calls from your marketing, and we find this particularly with consumer marketing. If you're doing newspaper advertising or radio advertising, you're going to get lots of calls from people that may not have the resources to buy what you're selling. And so you may have to have some clarifying or qualifying questions in that inquiry form so that you can make sure that this is a viable potential client before you get your car and drive out there and do the assessment. I would say that you don't need to do those qualifying questions until you are finding that you're getting lots of assessments and not converting them. If the data show that the conversion ratio from assessment to admission runs between 80 and 90%. So if you're going out making a lot of assessment calls and not converting 80% of them, then you need to go back to that notion of asking some qualifying questions during the inquiry to make sure that this is a serious candidate for your services. Good question.
Yeah, and I just want to add to that, because I guess with the qualifying, I have found if you truly ask the open-ended questions and assess the situation before you schedule the home assessment on that initial call, those qualifying, what I'm now understanding he means by qualifying questions, those get answered, and you truly do. You understand whether they've got the money to pay for things, or if they're really looking for a free service, or if they're looking for services that you might not provide.
Yep, good point. Good point. What other questions do we have, Jill?
Another question from Ryan, and he asks, do you let the person answering the call or the nurse doing the assessment make the decision on whether the client is a good fit for the company? So which person makes the decision on the fit for the client?
That's a good question. Barbara, what do you think?
Whether the nurse or the client makes the decision on the company?
No, whether the nurse or the person taking the inquiry call.
Right.
Oh, when we go out to do the home assessment is when we have to make the determination. Because once we're actually there on site and we see the real situation, it may be different than what we understood on the phone. And so I think whoever is on site is the one that needs to make that decision.
So if it may be a nurse in some companies, and in some states, like I think it's New Jersey, they're required to have a nurse do that assessment. In other companies or in other states, it may be the owner, it may be somebody in the marketing department, it may be somebody who's in a care coordinator role, or it could be somebody who's a geriatric care manager. But whoever it is that's going out to do that in-home assessment is the person who will ultimately determine if this client is a good fit for the company. And you may make that decision on a couple of criteria. One is the living environment they're in safe? Is this a home that we think the client is going to be safe in, and our caregiver is going to be safe? And then, do we feel that this is a family that has the resources to pay? And of course, in another webinar, we'll talk about avoiding bad debt and accounts receivable. That's another topic. But do we think they're going to be able to pay us? So there are a number of factors that will come into play for us to make the decision about whether we think this client's a good fit or not. But that's a great question. Thank you. Another question, Jill.
Okay, we have a question from Teresa, and she says, what were the 3 most important things you want the caller to remember when they hang up?
Those 3 most important things are dependent on your company and what the caller has to say to you, depending on their situation. It's not a standard answer that these 3 things are what they must always remember. You have to remember that when they hang up, they're only going to remember 3 things. And so each time that you pick up that phone, you have to connect with the caller and assess their situation enough so that you know just exactly what you want them to remember about you and your company and the services that you can provide for their situation. Not a magic answer.
Yeah, but I would go back to what we said earlier, Barbara, before the break about what's the caller looking for. And you mentioned they're looking for care. They're looking for somebody who is caring, somebody who demonstrates this honesty and trust. And so what we find is that it's really an emotional decision to buy home care services, and they're going to do that based on a feeling. And so I think what we want them to remember is how they felt as a result of that phone conversation. So it really comes down to, how does the person answering the phone make me feel? And that's what I'm going to remember, is the feeling of confidence, trust. This is a caring person, this is an honest person, this is somebody that I feel good about inviting into my home. And I think that's what they're going to remember.
And that's definitely one of them, Stephen, but then I think they still remember two other things. And my point there is, too often we give so much information that they go on overload, and they no longer remember just that feeling of caring because they get to the point of frustration and overload.
Exactly.
So we have to be very, very sure that we also give them not only that feeling of that you're talking about, but also they need some meat as well as to what we can actually do to make the situation better.
Great point. Let's take another question, Jill.
Okay, another question from Jill, and she asks, how do you avoid annoying people by putting them on hold while the inquiry specialist comes to the phone? Is putting them on hold a turnoff?
Yes, I recommend that you do not put anybody on hold if it is at all possible, and never for longer than 30 seconds without going back and acknowledging there. In my mystery shops, I have been put on hold for minutes, and every time I have my client listen to the shop, they're just like, oh my gosh, I cannot believe this. And had it not been a mystery shop, I would have hung up, absolutely. So I would not put somebody on hold. You're better off in your, go ahead, I see, Stephen, you put the answer order up. Yes, go to the next person.
Yeah, it goes back to developing this answer order so that there should really never be a time when you must put somebody on hold, because if the primary person taking inquiries is busy on a phone call or out of the office or out to lunch, the next person in the order is there and should be able to take that call and follow through with it. I think the only time that you might put somebody on hold is if once you've gone through the inquiry process and you're scheduling the assessment, and for whatever reason you don't have access to the calendar of the person going out, you might say, let me check just a minute and see that this person is available. And that's going to be the rare exception, because I agree with Barbara that in a business like home care, we're mostly small offices, unless they're calling for somebody specific, we should probably never put them on hold. Another question.
Sure. A question from Karen, and it kind of piggybacks on the same thing. And she says, our assessment specialist has other duties and her own schedule. How would you set up an initial call without her calendar available? So maybe
I always do a tentative. And one of the things I recommend is at the beginning of every day that the person who's going to be doing the home assessments gives you a copy of her calendar, whoever's going to be doing the scheduling. Understanding that from the time in the morning that you got that until it's now 4 o'clock in the afternoon, she could very well have scheduled something. So I always say, I'm going to put this tentatively on your calendar. And what the reason for that is, I have found when you've got a client, a potential client, an inquiry call coming in to schedule that home assessment, you're in a flow. Once you get it on their calendar, going back to changing the time and date is much easier than saying, I'll have my nurse or the person who's going to do the home assessment call you to schedule it. Because then they have called now the next company and they've already scheduled a home assessment with them, so they say, oh, well, never mind, I've already scheduled a home assessment with so-and-so. Versus if you put something tentatively on the books, they're typically not going to go and schedule another home assessment with another company because they've already scheduled one with you. So always put something on.
And I would take that to one more level, and that is that we really encourage you to automate as much of your business as possible, especially your scheduling software. And your scheduling software should have the capability to schedule an in-home assessment so that you would have a calendar for the person who does your assessments. And so the person taking that inquiry call should be able to go into the scheduling software and look at the calendar of that person and put that assessment visit right in their calendar. Now, obviously, they could have scheduled something else at the same time and there's a conflict, but that's going to be the rare exception. But automating as much of your business as possible, including scheduling, I think is really important. Another question.
Actually, we had one of the listeners, Tasha, suggested maybe using Google Calendar, which is free for the scheduling the assessment person. Just an option to put out there that everybody could have access to it.
Yeah, that's a good suggestion. So I was just with a client earlier this week, and they run a lot of their business using the features of Google, including Google Calendar, and they have Google Documents, and they have Google Spreadsheets, and it all resides out there in the cloud in a Google computer somewhere, and so they have access to everybody's calendar using that Google feature. So that's an excellent suggestion, Tasha. Thank you. Another question.
Actually, now that you said that, we've had a couple other people suggest GoDaddy or Saga Act, or other apparently calendar systems you can use out there. So,
okay.
Okay.
Great. Great. Again, the key, regardless of which software approach you take, the point is to automate as much of your business as you can using scheduling software, using telephony systems for time and attendance tracking, using QuickBooks or some other accounting software, and all of those integrated together so that you have easy access to information in your home care business. Next question.
Okay, a question from Anwar, and he asks, what are your opinions on having a directory phone system with a choice menu versus having a live person answering? Actually, it's from Ashley. I'm sorry.
I feel very strongly, Stephen, even though I know you want to automate a lot of different things, I think it's extremely important that the person is, when they get that phone answered, that it's a live person that answers the phone.
I agree 100%. Absolutely. When a consumer calls or a referral source calls, you want that phone to be picked up before the third ring or on the third ring by a live voice. None of this, welcome to XYZ Home Care, press 1 for admissions. People get really turned off by that, and this is such a personal business that we need to get as far away from that as possible. Now, the exception to that may be that you have a separate phone number for your caregivers to call into so that they don't go through the normal telephone inquiry process, that they have a separate number and they can call in where they can push a button to get to the person they want to talk to. If they need to get to human resources, they need to get to payroll, they need to get to scheduling, that's a separate issue. You can have a backdoor telephone number, but your main telephone number where inquiries and referrals are coming in absolutely needs to be answered by a live person. Next question.
Alrighty. Marlon asks, we have a higher than average conversion and lower than average closing in the home, and is normally due to financial issues. Do you have any suggestions?
Yeah, my response to that, and this is excellent to have that information, if you're finding that you're going out and making a lot of in-home assessments and not converting 80% of them, then it tells me that you're attracting the wrong kinds of inquiries or referrals, and that's where you have to go back to your marketing activities. And that's why it's so important to track all of this and to do that analysis, because then go back and look at where those referrals came from that are not closing. So take a look at every single case that did not close and look at where the referral came from. And I suspect what you're going to find is that they are consumer inquiries. They're coming from a newspaper ad or your website or somewhere like that, and they're people just shopping. Or the other thing to look at is how effective is the person doing the in-home assessment. If you're not converting a lot of those, then you have to ask the question, is the person that's going out there really doing a good job of developing that rapport and building the relationship so that the the client and the family have that level of trust and confidence to say, yes, this is the company I want to work with. And we have seen examples of that where they did a good job of scheduling the assessments, but when the person went out there and sat down face-to-face, the family said, nope, we don't want to work with this person. And they didn't convert. So, and that's one of those tough questions that you have to ask, and that's why you have to look at the data. Another question.
Okay. Question from Susan, and she asks, how do you feel about family interviewing caregivers? They often don't have any interviewing questions other than to see what the caregiver looks like.
What do you think about that, Barbara? Have you run into companies that offer the opportunity for the family to select their caregiver?
I have, and I do, and I think that's a very nice benefit of a particular company. A lot of people are more comfortable if they have that opportunity. On the other hand, there's a lot of times people are just trying to see the color of skin of the caregiver, which is something that we often have to overcome. I don't disagree with letting the caregivers come in, but I also think that we need to have learned quite a bit about the situation and have selected a caregiver that is appropriate for that situation, not just randomly have them say, okay, we're going to send 3 or 4 caregivers in and you choose, but have a predetermined caregiver based upon the situation. And it's more of a confirming interview rather than a selection interview.
Yeah, I agree. We see it both ways. We see those companies that offer to send out 2 or 3 candidates or 2 or 3 caregivers for the family to select from. We see others where we say we're going to do our job, which is to be the matchmaker, to match up the client and the caregiver, and we're going to send you a caregiver, and if for some reason you don't feel it's a good fit, let us know, we'll send somebody else. So there's no right or wrong answer to that, but it is an issue that we see companies doing both sides of that issue. And for some it works to offer a selection, and for others they say, no, we're going to make that choice and we're going to send the person that we think is the best fit. Next question.
Okay, this actually piggybacks on that. It's from Karen, and she says, what if you have an inquiry that wants to meet the caregiver before services are started? Do you charge for this service?
In my experience, the answer is no. The folks that are doing that do not charge for that meeting. Although I take that back, because there have been a couple of companies that have said that, you know, we will, but we still have to charge for a caregiver. It goes both ways. It depends on if you want to include that in as part of your marketing budget or not. My personal reaction is that I think that should be part of your marketing budget, and if somebody wants to meet a caregiver before starting services, that you should allow them to do so.
And I was just with somebody the other day that has as their policy that the person who supervises the caregivers and is the connection with the family goes out every time a new caregiver goes in and meets the family, meets the caregiver, and introduces the family to the caregiver. So it's not a case where the family gets to meet them and then decide yes or no, but the supervisor goes out with the caregiver, introduces them to the family, gets the case started, and the family always has the right to request a different caregiver if after the first shift they aren't comfortable with the person for whatever reason. They can always come back and say, we'd like to have a different caregiver, and most companies we've worked with will say, absolutely, we will work with you to find somebody else who's a better fit. And as you said, Barbara, unfortunately, in some situations, the decision by the client or the family comes down to things like the color of their skin. And that's unfortunate, but that is the real world that we live in out there. Other questions?
Sure. Actually, Becky wrote in with one of her experiences, and she said that they introduced the caregiver on the day of service, but by doing the assessment first, they can find the best caregiver for the client that will meet their needs. But sending a caregiver before the assessment has not worked for them. So just a little input from somebody else out there.
Good example. And one of the things that that we use as a benefit for the members of our Caregiver Quality Assurance Program is that they have those pre-employment assessments on each caregiver that look at their attitudes, their behavioral styles, and their cognitive ability. And so they use that pre-employment assessment information to help match the caregiver to the client. So if you're interested in more information on that, you can go to caregiverquality.com and take a look at the Caregiver Quality Assurance Program for more information. Let's take another question.
Okay, a question from Kelly, and she asks, how often and how long do you recommend we follow up on an intake that did not set an appointment?
Great question. What do you think, Barbara?
3 weeks is typically what I do 3 times in 3 weeks, but what I do is the first time that I call, I leave a message. Then I will call many, many times over that 3-week period, but I do not leave another message. Because the one thing that you don't want to do is have somebody, oh, they called again. Oh, they called again. So leave a message the first time, but then I continually try for about 3 weeks, and then I'll take a break. And then I will go back probably about 6 weeks later, because there's one of 2 things often happens. One, they either started service with somebody else, and 6 weeks is now a good break point in the sense of, are they happy with the caregiver and with the way things are going, or is there potential for me to win their business? And or the other thing that happens is somebody, gets into a crisis situation, and then they make the calls, and then the immediate crisis has resolved itself, so it goes back on their back burner, and they don't return a call, and then 6 weeks later you kind of bring it up, and then you find out what happened and potentially get yourself in the door to prevent another crisis from occurring.
Okay, another question.
Let me see here. A question from Ivana, and she says, our price does not vary, so can you give us another way to redirect the caller on the how much do you charge question? You may have answered.
If the price doesn't vary, so they'll go in for 1 hour, or they'll go in for 12 or 24 hours, and it's all the same pricing. So I guess I'm gonna go under the assumption that they do have a minimum number of hours that they would need to go in for, and so my response would be, I understand. We do have a price, but with the services that we provide are based upon what your needs are. She's making me think about this one, Stephen. You want to help me out for a second here while I think about how I want to phrase this?
Well, I think that, as you said, what you have to do is acknowledge and divert. And so you can say, yes, absolutely, we want to talk about the price, and that's important, but I think what's more important is understanding your mom's situation. Can you tell me a little bit more about that? There's 2 reasons to avoid giving the price, at least early in the conversation. One is there's some chance this is your competitor's mystery shopping. If all they want to know is your price, you don't want to make it easy for them. The second is if this is a person that's only interested in price, and you go to the script that Barbara shared earlier about, well, give me your contact information. I'll send you a list of the 3 lowest price companies in town. That, again, is one of the ways to divert away from that. And if all they want is price, then you get their information, you send them that list. But to the questioner, that's a good point, is that if you charge $18 an hour and that is your price, then that is the price. And at some point during the phone call, you may get to the point of giving them that number. But I wouldn't do that early on. I would do as much as you can to get the questions on the inquiry form answered so that you have a sense of the situation. And again, so that you're not easily giving your prices to your competitors. Barbara, you can say something?
Yeah, there's 2 things I want to add to that. And one of the reasons a lot of people ask what is the price is simply because they don't know what else to ask. But the other thing is, if you only have one price, I'm making an assumption here because I can't ask you directly, that that price is probably higher than companion care with your competitor versus personal care. If someone else has two pricing, typically the companion care is going to be less than personal care. And if you have one pricing and you know that it's a little bit higher than if somebody only needs the companion care, one of the things that I have found extremely effective is that when you present your pricing, you explain that the reason you have the one pricing as opposed to having graduated is because you have found that when you send in a caregiver and they've developed a relationship with your mom or your dad and their care needs change, we don't want to have to change the caregiver based upon your mom's needs. Our caregivers are all capable of dealing with your mother's situation even as things and her needs may change. So I do preface assuming that that pricing that you have is going to be a little bit higher than your competition on companion care.
Boy, lots of great questions here this afternoon. Let's take another question, Jill.
Okay. Looks like we're down to the last couple, so we're getting there.
Okay.
Karen asks if you could provide a list of some good open-ended questions.
I absolutely can, Stephen. If you want me to email, I have 2 pages of them. So
okay, sure.
That are on I'll be happy to email to anybody who wants to send me an email. I can send you the list of questions, but there are a couple on the inquiry form.
I'm going to scroll ahead to there's Barbara's email, Barbara Akst at Training Unlimited, Barbara at Training Unlimited VA for Virginia.com. So go ahead and email Barbara, and she will be happy to send you that list of open-ended questions. Let's take another question or two, Jill, and I think you said we're getting close to the end.
Yep, I think we just have one more, and this goes back to the case study. And John asks that you mentioned earlier that 37% of conversions were average. Is that conversions to assessments or admissions? I'm assuming that not all assessments result in admissions.
That's correct. It's 2 different numbers. The first number, and I'll scroll back up there quickly. The first number is the percent of inquiries that get converted to assessments, and that's this number right here, the inquiry conversion. And so that number is running about 39% for all companies in 2011. Then the next number is the conversion of assessments to admissions, and that number is running right at 80%. So we're going from 40 to 80 basically at those 2 different steps, and that illustrates the importance of doing that in-home assessment. What we don't know is the conversion for people that don't do an in-home assessment. What percent of inquiries get converted right to an admission? And our experience is that number's probably in the 20s. But we didn't track that with this particular study. But in those companies that don't do as part of their process an in-home assessment, what we find is their conversion ratio is pretty low. Another question?
Just one other one, and it's from Joe, and he asks, what are some of the most effective opening questions? And this might run along with the open-ended questions, but I still wanted to put it out there.
It does, and what's most important in your open-ended question is it be one that is comfortable based upon your caller style as well as your employee style. And as Stephen started mentioning a little bit about behavioral styles of the caller, that's important to consider. Some are more closed, some are more open. So typically if you start with something like tell me about the situation, that can lend itself to somebody who's very open or very closed, very factual, very emotional. And depending on how they answer that question, you then know whether to go with more open-ended questions that are going to get to the touchy-feely side or more open-ended questions that are going to stay more with the factual side for what I refer to as the thinker. And in the open-ended questions list that I do have, I have both for either the thinker and the more closed person or the more open and feeling type person.
Okay, great.
All right. We actually got one more in. I think we can squeeze it in quick.
Okay.
Sorry. It's from Amanda, and she just asks, do you have any suggestions for help with warmth and tone of voice on the inquiry call?
One of the things that I have found most effective is to take a very deep breath before you answer the phone. Taking that deep breath, and I mean really deep, and letting it out will actually change your tone of voice. The other thing is to have a mirror by your computer and to look in it so that you literally have a smile on your face when you pick up that call. Third thing is to isolate. There's so much going on in all of our offices that you need to be able to, and sometimes it's think of yourself like a horse who's putting the blinders on, and you may physically have to lift your hands up to your eyes, but focus on that inquiry form and tune out everything else that's going around you. So your phone rings, your hands go up by your eyes, you take in this deep breath, and then you look in the mirror and you smile and you pick up the phone with a warm greeting. Thank you for calling ABC Home Care. This is Barbara. What can I do to make your day a little bit better?
Excellent, excellent. Have we ended our questions, Jill?
We have.
Okay, well, that's terrific. We're 2 hours into this program, so obviously a lot of people had a lot of interest. And so, Barbara, we want to thank you very much for coming out today and being with us, and for staying this long to answer all of those questions. So, Jill, I will turn it back over to you.
All right, we thank you so much for joining us today for Capture the Caller, Turning Inquiries into Admissions in Private Duty Home Care. And again, if you did not receive a copy of the slides for today's conference, you can email me at jill@leadinghomecare.com and ask for those slides, and I'll send them to you. After you have reviewed your notes from today's web conference, you may have some follow-up questions. If so, feel free to email those questions to Stephen at stephen@leadinghomecare.com. And I assume if it's okay with Barbara, people may email her with any questions. If not, let me know.
Oh, no, absolutely.
Okay. Our next webinar for the Academy for Private Duty Home Care will be on Thursday, January 24th at 2013 at 4 p.m. Eastern Time. Keep an eye out on in our newsletter and website for more details on our upcoming webinars and workshops. And we thank you so much for joining us today. We look forward to seeing you in 2013 and hope you all have a very Merry Christmas and a Happy New Year.
Bye now. Thanks, everybody.
Take care.
Thanks,
Thanks for
Barbara.
being here. Bye-bye.